You're listening to Ask Dr. Jake. My name is Dr. Jake Tucker. I'm the owner and founder here at Good Life Family Chiropractic on the south side of Lincoln, coming to you today with another message of hope, health, and wholeness. And I wanted to share with you a story again, and really, August 26th, an indelible date in my mind. It's just transformed my practice ever since that day, because really my life was transformed on that day. I was going about my morning here in the office just like any other morning when my wife called me and she said, Jake, Zeke stopped breathing. And now Ezekiel's our youngest child. He was born earlier this year, March 9th. And he had been our healthiest, happiest baby, easiest baby. It was probably too easy by all measures, but we drove over to the emergency room and they were kind of filling us in with what had happened. Apparently, he was laying in his crib going down for his nap, flipped himself from his back to his front because he preferred sleeping that way. And as he did so, he let out a squawk. And when they came over to check on him and why he had squawked, he wasn't responsive. He wasn't breathing, and they couldn't resuscitate him. They did him 2 rounds of CPR, 2 rounds of rescue breathing before he came back. They rushed him over to St. E's to try to figure out what was going on. On the way, they noticed that he was having a seizure and that he was still struggling to breathe. And that was right about when I got there. So I was just being updated on that. And so I went over to him where he was laying on the hospital bed, and I picked him up in my arms, and he was shaking with his seizure and he was struggling to breathe still. And I started praying for him, and I just instinctively put my hands on his neck. And what I found was just amazing to me, because this is a baby who's been adjusted since birth, who's had chiropractic care since birth, who's had the best of nutrition, the best of health his whole life, all 5 months of it to that point. And his atlas was so far out of alignment that I could feel it poking out of the right side of his neck. And so I just started adjusting him. And like with a baby, it doesn't take much. Most babies aren't difficult in that they're difficult to adjust. It doesn't take much to move the bone. It's just a matter of massaging the vertebra back into place and knowing where it needs to go. And that's what I did. I just massaged it back into place. And as he did that, his life came back. He started breathing normally. He stopped shaking. He asked for his mom, which at 5 months old, it's not much more than mom, but he did it. And he nursed until he fell asleep. And ever since that point, in spite of the thousands of dollars of testing that they did, in spite of no medical interventions other than to resuscitate him, and I thank God for the daycare workers and how on top of it they were, because without any of that, he would be a SIDS baby. Because in spite of my telling the doctors what I was finding and showing them, where he was misaligned, not a single one of them did a test. Not that they even necessarily knew to do a test to check for that much misalignment in his atlas, or look and see the distress he was under anytime I put my hands up around the area that had been damaged. Because what happened that morning, and I found this out after the fact, is that before my wife left the house, he had rolled off the bed. She had caught him before he hit the floor, but it was by the head and kind of neck. And then immediately following that, like while he was still in her arms and while she was still gathering him, his older sister, 2 years old, was not wanting to put her pants on. And so she kicked and happened to kick him in the head at the same time. Now he's a big baby. He's a strong baby. And so he didn't have any immediate reaction to that. But within an hour, by the time he got to daycare, when he was going down for his nap, that misalignment had become so severe that it had started to cut off vagus nerve as it exited out and went to his lungs, and cut off the free flow of information between his brain and his body. And so his body went into that seizure as well. And if it hadn't been for my training and my being there in that moment, we might still be wondering what the problem was. And some of you might be sitting there saying to yourselves, I'm dealing with a health issue that the medical doctors don't have an answer for. They can't tell me why I'm dealing with it. They can't tell me what the cause of my problem is. They can't tell me a clear path to get correction. All they're offering me is drugs and then exploratory surgery, or that I have to go to another doctor, another special doctor for another special test. Look, we went through this. We were in your shoes. We walked through this process over the 3 days following it. They started off and they took a chest X-ray in the room. They wheeled the X-ray machine in there, and while they were doing that, they hooked him up and they got his blood, which took them forever, but they eventually got his blood, and they started to test it to see if there was an infection. Then they rolled him down to the room where they could do a CT scan on his brain, and they wanted to check to see if there was any problem with his brain. And then from there, they called Children's in Omaha, and they drove us from Lincoln all the way out to Omaha, and we stayed there for 3 days to monitor and see if the problem happened again. And while we were doing that, we did an EEG on his brain. We did an MRI on his spine. We did a spinal tap to see if there was an infection in the spinal cord. And in spite of all these tests and all the thousands upon thousands of dollars that we spent to try to figure out what was going on, the only thing that we ever found wrong was that his spine was out of alignment. His spine that God designed to protect his central nervous system from the damage that would have been inflicted had there not been a protective mechanism when he fell off the bed or when his sister kicked him in the head. That had been shoved out of position so that it was actually creating an interference to his normal, healthy healing process. And it was the adjustment, and not just one. I adjusted them multiple times a day for each of the next 3 days before I finally felt it relax and go. And now we're at the point where months later, he's going days at a time without any hint of misalignment at all. And even though his habits returned to normal, it took time to overcome and heal from that injury. That's the process we went through. We went through the same thing that you're going through, just maybe it has a different name. Maybe they gave it a diagnosis that doesn't sound like anything they might have called what my son had. Maybe it's dementia. Maybe it's Alzheimer's disease. Maybe it's multiple sclerosis. Maybe it's sciatica. Maybe it's low back pain. Maybe they give it the fancy term. Maybe they call it lumbago or cervicalgia, or they're calling it, tendinitis. But they're not telling you the cause. If they're not telling you the cause, then we need to start there. What's interfering with your body's ability to heal and function? When we can find that, then we can start to remove that interference and allow your body to heal. And if you need hope for the first time with whatever you're dealing with, I suggest you pick up the phone right now and call my office, 531-289-7100. We're finishing up our morning shift here just in a few minutes, and we're happy to take your call and talk you through what it looks like to come in for a consultation, to do an exam, to look to find the cause, whether it's through posture or range of motion, feeling your spine, doing a surface electromyography, digital nerve scan, or taking an X-ray to see how your spine's out of alignment. That process would normally cost thousands of dollars. And I can tell you, I can vouch for that. I just went through that with Zeke. We're still paying that off. We'll probably be paying that off for next Christmas. This kid's not getting Christmas presents from us for years because of what he just put us through. But if you want to look for the cause today, if you set up an appointment by calling right now for the next week, we'll give you a 50% discount off of the exam and off of any necessary x-rays. At most, it'll cost you just $65. And then if you need an adjustment same day, we'll also include that as part of that discount. 50% off, it would just be $30. So pick up the phone, call our office, 531-289-7100. Again, 531-289-7100. You can also find us at goodlifefamilychiropractic.com. You can request a free virtual consultation. Obviously, I wouldn't be able to do an exam over the phone, but that would just be 15 minutes where we get to sit and talk about what potential things could be playing a role in that, and then figure out what steps need to be taken to move forward. And really, it starts with knowing what health is. I knew in that moment when my wife called me that there was something interfering with his ability to breathe. I thought, given that he's only 5 months old and that he likes to put things in his mouth, he was probably choking. That was my first thought, that he was interfering with that. And then when I got to the hospital and I figured out that no, it wasn't that he choked, that it was something else, that my thoughts went straight to the central nervous system. But unfortunately, that's one of the most ignored systems in our healthcare system. You think about, just what they do when you go to the doctor's office. Unless you have an obvious neurological symptom, they don't even consider it until after you've tried everything else. You go in, you have a little bit of back pain. They they do some tests, they take your history, and then they give you a diagnosis. And based off that diagnosis, they'll give you a little bit of medication. Maybe they'll give you a muscle relaxer and an anti-inflammatory. And then if that doesn't help fix it, they'll go back, they'll do another test. Maybe they'll change their diagnosis, which really is just a Latin term for the symptoms that you're experiencing. And then they'll give you a different medication. And then if that doesn't work, then they'll send you to a special doctor. The special doctor will run a special test, maybe give you a special diagnosis, a special drug for sure, all at a special price. And then that will end up turning into surgery. And if you're just talking about back pain, the average case of back pain in the United States, on average, and this includes the people that just walk out with the muscle relaxer and the anti-inflammatory, you combine all those numbers together, it costs us $80,000. This is the most expensive healthcare system in the world. We have the best doctors, best facilities, best research, but all of this, and we take the most medications in the world. We're doing the worst amongst all the industrialized nations, all the countries that want to spend as much money as we do and want to get as good an access as we have. They do better than us in spite of having worse resources. And it has to do basically with philosophy, because what we're doing and what our medical system is doing is basing your health off of how you feel. It's basing your health off of your symptom, when no definition of the health in the world defines health as the presence or absence of symptoms. Your health, as defined by the World Health Organization, Dorland's Medical Dictionary, is a state of 100% optimal function and healing across mental, emotional, physical, and I like to include spiritual as well, because I was a pastor before I started doing this. Because if you're not healthy in any one of those areas, if you're not functioning or healing in any one of those areas, it will interfere with your ability to stay healthy, fight off infection, fight off cancers and heart disease and diabetes. Your body is fearfully and wonderfully made. God took two cells, put them together in utero, and started to duplicate and replicate it 36 trillion times to form this living, loving, thinking clay. And he put one system in charge of all function, and that's your central nervous system. Your brain, your spinal cord, the nerve roots, that controls how your heart beats, how your lungs breathe, a cut on your leg healing. And so if you haven't looked at your central nervous system to see if it's healthy, if you haven't looked at the spine to see if it's properly protecting your nervous system, then you're missing out. Even if you've been to a chiropractor before, if all they did was take care of you until your insurance visits ran out, then very likely they missed the point of what being a chiropractor is all about. It's about finding the cause, looking to make sure that the nervous system is healthy, and no insurance will ever do that. And the reason why is because of medical necessity. They state that any care that seeks to prevent disease, promote or enhance the quality or longevity of life is not considered medically necessary. Call my office right now if you need help. 531-289-7100. First 5 callers get a 50% discount. I will see you again tomorrow for another episode of Ask Dr. Jake.